This is Mayo Clinic Kids, a podcast from Mayo Clinic where we discuss the latest pediatric research and recommendations to help keep your kids laughing and thriving. I'm Dr. Angela Mackey, a pediatrician with Mayo Clinic in Rochester, Minnesota. This episode, why is my head itchy? Molly, have you ever seen a patient in clinic who's just like constantly itching their body, or maybe they have some type of illness or disease or infection that is causing their scalp to be really, really itchy, and all of a sudden you're like trying not to itch your scalp, but it's driving you crazy?
Yes, definitely. I would say that's relatively common in dermatology clinic. We see lots of patients who are incredibly itchy, scratching their skin or scalp to the point of bleeding. And the residents and I, upon leaving the room, are finding ourselves washing our hands, feeling like we're scratching ourselves.
Yeah, I have definitely, seen patients with head lice or bed bugs in my clinic, and I can't stop itching myself the entire day. And I feel like it's all in my head. Do you know anything about that? Is that like a real thing?
It is a real thing. So when one person is scratching, another person feels like they need to scratch as well.
It's kind of like the contagious effect of like yawning. Someone yawns and pretty soon everyone yawns. And man, I hate it when I start yawning in front of my patients if they yawn first and then I yawn.
Yeah.
See, right, I want to yawn now that I've said that.
Yes, me too.
When you see your kids scratching their head, your gut instinct might be to reach for your keys to go get head lice shampoo. But itching can be a symptom of a ton of things, ranging from the superficial to the serious. So how do you solve the mystery of your kid's itchy scalp? And what can you treat at home versus going to the doctor? And of course, the time-honored question is, how do you stop scratching when it feels so good? Because surely the answer isn't duct taping oven mitts to your kids' hands. Before you start scratching your own head in confusion, we're talking to Dr. Molly Youssef. Molly is a pediatric dermatologist at Mayo Clinic in Rochester, Minnesota, where she treats a whole range of skin conditions in kids. She's here to help us learn why your kid might be scratching their head and how to find relief. Thanks so much for joining us today, Molly.
Thank you, Angie. It's a pleasure.
Molly, like we just talked about, we've all experienced itching, whether it's actually you and I in clinic seeing a patient who's having lots of itchy rashes. But what actually causes it? What is happening in the nerves and the skin cells that makes us want to scratch our skin away sometimes?
It's known that itch is due to a specific type of nerve called C nerve fibers. So these are actually slower transmitting nerves, but they're found in the skin and they transmit sensation to the spinal cord and the brain. And actually, there's different types of C nerve fibers. Some of them are more stimulated by a chemical called histamine that we have in our body. So it's thought that those nerves actually drive the itch that is histamine triggered, such as itch that occurs with hives and more acute type itch. So itch that develops very rapidly. And then there's chronic itch, or itch that's been occurring for months or years that some patients experience. And that type of itch is thought to be related to nerves that are not triggered by the histamine chemical. And then it makes sense why some types of itch respond to the antihistamine medication and some don't.
Right. So does that have any part in why it feels so good to scratch that itch sometimes?
Yes. So the nerves that play a part in driving that itch, transmitting that itch feeling, like I said, connect to the spinal cord and brain. And then when you actually scratch, some endogenous opioids in the body, another type of sort of chemical, if you will, in the body, are released. So opioids are kind of our reward chemicals in the body. And that's why when we itch, it feels really good and we want to keep scratching.
So as a parent, is an itch always a cause for concern? Because if one of my sons says to me that their head is starting to itch today after school, how seriously, should I take this? Should I be freaking out, starting to look for lice?
I mean, you don't have to start freaking out right away. Certainly reasonable to take a peek at their scalp, of course, see if anything looks unusual to you. and then you can kind of go from there. But it's just so common. It might just be something that's just going to be occurring for a day or two and then resolve. But yeah, we can talk further about kind of things to look for parents.
Is there something that tips you off that it's more than just an itch that we can just benignly ignore and see if anything comes of it? Or is there something on their scalp, a certain appearance that maybe should prompt you to reach out to one of your medical providers?
I think if there's true blisters on the scalp, like fluid-filled bumps that either are filled with clear fluid or filled with pus-looking fluid, that would be a reason to see a doctor. Also, if there's a lot of drainage or crusting on the scalp as well, might be a sign of infection. If there's areas of the scalp that overall feel what we call boggy, so just kind of squishy, that would be really unusual. And if you notice, a lot of enlarged lymph nodes in your child's neck, you're seeing lumps on the back of their neck or front of their neck, that might mean that there's an infection or another issue going on in the scalp as well. One other factor is the degree of itch. So if the child is just incessantly, persistently scratching their scalp, and that's creating bleeding or scabs or difficulty focusing at school, that would be another reason to have them evaluated.
So itching is obviously a really common symptom, but we always want to figure out what the cause is. So let's go over some of those categories of things that can cause itching, starting really with those skin issues. What are some of the common skin conditions that cause itching?
When we're specifically talking about the scalp, seborrheic dermatitis is one that comes to mind right away. It's a condition of the scalp, otherwise known as dandruff, but it can range from mild white flaky dandruff to more severe scalp inflammation with a lot of the redness and the thicker scales. Sometimes we even see so much scale starting to suffocate the hair follicle to the point that the patient is having hair loss and a lot of pain of the scalp. So that's a common skin condition of the scalp. Of course, itching also occurs commonly in kids due to eczema, also known as dermatitis. And eczema commonly occurs in babies on kind of the extensor, so more like the elbows, knees, face, but then in older kids, kind of the crooks of the arms, the back of the knees, those types of areas, hands and feet as well. So kids with eczema are actually prone to having dermatitis of the scalp as well. And then psoriasis is another condition that is commonly seen on the scalp. And psoriasis looks a little bit different because the plaques are what we call more well-defined. So there's kind of a definite start and stopping point, and they're kind of thicker pink areas with a lot of silvery scale.
So it sounds like the psoriasis tends to be kind of more distinct, separate plaques where you can see the edge where it starts.
Yes.
And the seborrheic dermatitis or the dandruff, can it be all over the scalp or can it just be parts of the scalp? What would be kind of a visual sign to help distinguish between eczema of the scalp versus seborrheic dermatitis or dandruff?
So it can be a little bit tricky to distinguish, and there can be some overlap. Eczema of the scalp sometimes looks a little more just like severe dryness of the scalp with a lot of flaking, but that can also overlap, I guess, with the appearance of seborrheic dermatitis. One of the classic appearances of seborrheic dermatitis, though, is having a little bit more of a yellowish greasiness to the scale. So that can help to set apart the seborrheic dermatitis a bit more. But it is true, seborrheic dermatitis can occur in various areas of the scalp and move around. It can occur around the ears and on the ears, so that can also be a clue. But regular eczema can occur on the ears as well.
Does any of like a child's history help you kind of, if it's a tricky case, sort between eczema or seborrheic dermatitis, or does it really not matter what exactly the cause of it is because you can do a treatment that would cover both?
Yeah, I think when there's a history of eczema in the child, then it's more possible to be an eczema of the scalp. It's relatively rare for people to have an isolated eczema of just the scalp and not elsewhere on their body, unless they have a contact eczema to something they're using on their scalp. So they've developed an irritation or an allergy to a product, then they might have an eczema just on the scalp. But usually kids with eczema on the scalp have eczema on the rest of their body in some form as well. But overall, the treatments are fairly similar too, with specific shampoos that we can recommend and some other topical treatments.
Well, let's talk a little bit about those treatments. Does it seem reasonable for some of these things to parents to try some at-home stuff before they reach out to their doctor or come to see the dermatologist?
Definitely. One of the things we hear often is that when the child's scalp is looking kind of flaky, parents are worried that it's dry. And
Mhm.
so they start to wash the child's hair less frequently. And that typically actually worsens the problem. So if there's a seborrheic dermatitis going on, we do recommend actually washing the hair more often, ideally every day if possible. And then parents can try over the counter anti dandruff shampoos as a first step for seborrheic dermatitis and sometimes can help regular eczema as well.
Mhm.
So, some of the over the counter shampoos containing selenium sulfide, zinc pyrithione, and ketoconazole as well. So, typically each product has like one of those ingredients or two, but it's helpful for parents to maybe buy two different shampoos and rotate them so that there's more than one ingredient that might help the scalp and they can use one shampoo each day.
I just chuckled to myself as you rattled off those really hard to say names with like no problem whatsoever. I was like, oh, that's how you say it. I didn't know that.
Hopefully, I'm saying it correctly. You never
I
know.
usually am just like, the salala, it's like, it's on the bottle. Just
Yeah.
look for that. How serious are these conditions? More importantly, I think parents always wonder if I don't do anything about it, is this going to cause, long-term consequences for my child if left untreated?
No, I mean, when we're talking about seborrheic dermatitis or eczema of the scalp, it's not going to typically cause long-term harm unless there's, like we were talking about, severe deep scratching that could lead to scarring or something along that nature, or if there's infections occurring. But overall, it's common that I incidentally find, oh, you have some
Mhm.
seborrheic dermatitis here. And the patient's like, oh, my scalp's not itchy, nothing's going on. And I say, well, if you want to try an over-the-counter anti-dandruff shampoo, go ahead. But most of the time, patients, if it's not bothering them, they often elect to not even treat. So not long-term consequence if it's not bothering the patient.
Why do kids feel itchy in the first place? Well, we all have C nerve fibers that, when triggered by histamine, can transmit those itchy sensations up the body. Then we have other nerves that transmit other types of itching, chronic and long-term itches. Itching is not always a cause for concern. It might just be a passing sensation. But if your kid has blisters or signs of infection like drainage, crusting, bogginess, or enlarged lymph nodes, make sure to get them evaluated. Same goes if there's a high degree of itching. Your child might experience itching due to dandruff, seborrheic dermatitis, or eczema. These typically aren't cause for worry. If you think your kid might have one of these and it's affecting their scalp, feel free to start treating it with an anti-dandruff shampoo. You can try 2 alternating products with different ingredients to see what sticks. Like I mentioned earlier, I think a lot of parents automatically jump to itchy scalp equates to head lice. And
Uh-huh.
oh my gosh, what are we going to have to do to treat this? Well, Molly, let's start with head lice because I think that's the one most of us are pretty familiar with. I know I still feel traumatized from my childhood when I got head lice at my grandma's house and had to go through the whole ordeal.
Yeah, so the things to watch for on the scalp for head lice are particularly, of course, the lice organisms themselves, so those little tiny crawling bugs, but that you can also see the nits as well. So those are probably a little bit easier to see, and they look like whitish to light yellow, tiny beads around the hair, and that can be evidence that there's some eggs in the hair from the lice. And I think those are the most common things that you can try to check for. And then, of course, the itching that might be present.
How contagious are they? I feel like as kids, I thought they were going to like jump off of one person's head and jump onto my head.
Fortunately, lice are not able to jump or fly, and they actually don't survive on our pets either. So those are all reassuring factors. Really, you need direct contact with the head of someone who's infected to really have the lice transmitted to you. There's still some controversy as to whether lice survive very long on objects such as hats, towels, combs, that kind of thing.
When we were a kid, they would enforce these no knit policies, and the school nurse would be checking people's hair before they would let them come back to school. And I know that the AAP and the CDC and all these associations have really advocated pretty hard against that. So the kids aren't missing school and missing educational opportunities and opportunities to eat and other things like that, where a school provide all essential resources for children. It really puts an unnecessary burden on families and children and increases absenteeism. Other than the annoyance of itching and having to treat lice, is it really a serious condition or could have any serious long-term consequences if not diagnosed and treated?
No, it's not a serious condition. There's no other long-term health consequences related to it.
And do you generally recommend that families just start with the over-the-counter lice treatments that are available to them? Because I know that there are prescription products available to families as well.
Yeah, I typically recommend starting with over-the-counter treatment.
And I think I would add, I know there's some areas in the United States where there's like high rates of permethrin resistance and things like that. And if you know that that's your situation, you can always reach out to your provider and see if they feel that any of the prescription strength products are required or needed. So what parasites can actually cause itching that we tend to always associate itching and head lice?
Scabies can cause some scalp itching. So scabies is interesting in that in most patients, it does not affect the scalp. It really only infects the scalp and causes itching and lesions potentially on the scalp in infants and very young children. So I would really limit my thoughts on scabies of the scalp to really infants and toddlers. For those age groups, we do tend to treat the scalp
Hmm.
with the topical permethrin as well as the body, whereas in older children and adults, we just treat the body and neck.
Is there a specific visual finding that is associated with scabies in that scalp region in young children and infants?
You can see more papules or nodules, so basically more kind of larger bumps on the
Hmm.
scalp in young children.
Is scabies kind of like lice in that there aren't serious long-term consequences if it's left untreated, or is this one in a more serious category?
No, it's similar, I guess, to lice in that there's not long-term serious consequences.
Both lice and scabies still seem to have a pretty significant stigma associated with them.
Yeah.
How do you help address that with families in the office if they're getting diagnosed and they're feeling a certain kind of way or feeling that people are thinking certain thoughts about them?
I mean, I try to reassure families that these infections or infestations, we might call them, are still quite common, not
Hmm.
related to hygiene or cleanliness of the home in most instances, just related to someone they happen to contact who had the infestation. Yeah, so try to kind of take the guilt off of them and just get them treated, and then they can carry on and not have to worry about it anymore.
Yeah, absolutely. Let's talk about fungal infections like tinea capitis, also known as ringworm of the scalp. What does that look like on the scalp, and is it different than on the body?
So, tinea capitis is a common fungal infection of the scalp. There are some similarities, I guess, to how it might look on the body. The classic kind of ring appearance on the body with a raised border isn't always visible on the scalp, but we do see often kind of circular pink spots on the scalp that are quite scaly, kind of with that whitish or yellowish scale. And then one feature on the scalp that can kind of clue us into ringworm of the scalp is usually we see broken off hairs in the area of that redness and scaling.
Do you ever see any overlap between seborrheic dermatitis and ringworm, or just having difficulties distinguishing what's what? And if so, how do you do that?
It can be a little tricky to distinguish. Usually with ringworm of the scalp, there's kind of more spotty areas involved, not quite so diffuse or the whole scalp involved, but occasionally it is. But to figure it out, we usually in the office do some scraping of the scale and then try to look at it under the microscope. Another thing we can do is what we call a scrub culture. So we kind of have fun with this in clinic because we use a toothbrush. So patients like that. It's soft, it's not scary for children. And we just rub
Hmm.
the scalp where there's scale with the toothbrush and put it on what we call an agar plate, which allows our lab to culture out fungus if it is present.
Can ringworm of the scalp become a potentially more serious condition if we leave this one untreated?
Yeah, it has potential to lead to a little bit more serious disease. When I had mentioned before bogginess of the scalp, so when the scalp kind of
Hmm.
feels squishy and boggy, that can occur with untreated ringworm of the scalp and can lead to a condition called a carrion, which is a deeper and basically kind of the area under the skin of the scalp has become almost kind of liquefied and squishy. And that can be a little bit more serious.
You know, for a lot of different types of fungal infections, there's a lot of over the counter treatment options available.
Mhm.
Is that apply in fungal infections in the scalp region?
So unfortunately, the scalp is a little bit different in that when you have ringworm of the skin, you can use an over-the-counter cream and it may work for you. Because fungal infection of the scalp, the fungus has actually gone down into the hair follicle and kind of towards the root of the hair. That cannot be treated with a cream, unfortunately. So it does require usually prescription antifungal oral treatment. So either a pill or a liquid medication.
And that can take a long time to get better, right? How
Mhm.
long do you end up typically treating those patients?
Typically at least 8 weeks, sometimes 12 weeks, and then we see them back and make sure that the infection appears to have cleared, and sometimes need to treat longer if needed.
Can you get itchy because of bacterial infections?
Yeah, if there's been a lot of scratching, there's potential for bacteria to enter and cause infection that can also be itchy.
What other types of things can cause itching of the scalp that may be related to an allergy?
Allergic contact dermatitis is one condition that we see affecting the scalp from time to time. We can see the allergy developed due to a variety of different products that can be used.
Is there any TikTok favorites that tend to be, common culprits?
I would say definitely hair dyes
Okay.
are a common culprit. Otherwise, it's just so variable
Mm.
person to person which component of a shampoo or hair product might be causing a problem for them. As far as other allergic reactions, of course, it's not that uncommon for children to develop reactions like hives, which can be due to a variety of triggers, most commonly a viral illness. But
Mhm.
we actually don't see hives occurring that commonly on the scalp. The face, of course, can be involved, but the scalp is not as common of a location.
What would be the signs of like an allergic contact, dermatitis, or reaction to something on the scalp?
Usually, an allergic contact dermatitis is very itchy, very red, might be scaly or weepy,
Uh-huh.
and then kind of well defined. So I would expect it to involve most of the scalp, but kind of have a clear cutoff at the edges of the scalp. Although that's not always the case, but that can be a clue.
If I had like weepy red scalp, I would be a little bit concerned about that.
Mhm.
Is that potentially a serious situation, or is that something that you can potentially just wait out or treat at home?
If it's becoming quite painful for you and quite weepy, I would recommend being seen for that just to make sure there's not an infection. I would say it's difficult at home to determine whether you have an infection or an allergic reaction. And sometimes it's even difficult for doctors to determine one versus
Hmm.
the other. So I probably wouldn't wait it out at home too long if it's continuing to worsen.
You mentioned viruses can cause hives, but
Hmm.
man, viruses can cause a lot of different rashes of the
Hmm.
skin.
Hmm.
I feel like that's like a daily occurrence in my office of, I think it's a viral exanthem. I think it's a viral rash, and thankfully we're in a phase where we have immunizations to prevent against a lot of these diseases that would cause itching of the scalp and rashes and systemic things that could be really serious and often fatal. Can you talk a little bit about some of those diseases and how they may manifest with, itchy scalps and other things along those lines?
Of course, there's the typical viral exanthem, as you described, which is kind of nonspecific. It usually looks just kind of like pink spots and maybe some mixed pink bumps.
Hmm.
And a lot of times we might not know exactly which virus is causing that. But then there's some other viral skin rashes where we more clearly know what it is. For instance, chicken pox typically looks more like pink bumps, but then they develop a little blister, commonly referred to as a dewdrop on a rose petal, if you can think of that on the skin. Of course, chicken pox can be more serious, and the chicken pox lesions can affect the scalp, but typically, of course, occur on the entire body as well.
I feel like a lot of those other viral exanthems that we see of just kind of common, whether it's common respiratory viruses or other kind of systemic, non-serious viral illnesses, they don't generally involve the scalp very much, at least not what I see in my office. Do you ever see some of those more non-specific viruses involving the scalp, or do they tend to be more trunk and extremities?
That's correct. Most of the viral exanthems are not involving the scalp.
Are there any like constellation of symptoms or order that we tend to see symptoms in that helps you tell that this might just be a viral exanthem and not something more serious?
So, I guess when the rash is occurring in conjunction with runny nose, cough, maybe low grade fevers, and typically, viral rashes are not blistering. There shouldn't be changes involving the lips or mouth, those mucosal areas. Typically, that's more reassuring that it's just kind of a general viral exanthem.
One other thing I would add is if your child's not immunized, that puts them in a whole different category when they develop fevers, runny nose, nasal congestion, cough, and rash. We're seeing measles
Right.
reemerging across the United States, and it keeps coming and going in epidemics. And measles starts with runny nose, nasal congestion, cough, and then development of fever and
Yeah.
rash and stuff. So just a huge plug to get your
Right.
child immunized against these really preventable but serious illnesses.
Yes, so true.
If your kid's head is itching, it could be a parasitic condition like lice, which you can check for by looking for the insects themselves or their eggs. You can start treating with an over-the-counter product. Another parasitic condition is scabies, which might show up as scalp itching in infants and toddlers. It can look like large bumps, which you can treat with a topical. For older kids, scabies might be apparent on the body and neck. Scalp itching can also come from bacterial infections or might be due to something fungal instead, like Tinea capitis, also known as ringworm. This can look like a ring with a raised border or scaly pink dots in concentrated areas. To check for it, doctors can do a scrub culture. Fungal infections on the scalp require an oral antifungal prescription, and it typically takes at least 8 weeks for the infection to clear. Then there's itching due to allergies and rash like contact dermatitis, or itching from viruses like hives or viral exanthems. If your kid is experiencing itching along with a fever, runny nose, and cough, it could be something more serious. Okay, Molly, let's move on to talk about how we treat the itching. We've talked about a lot of different conditions that can happen on the scalp. And obviously, at some point, you're really going to want to tailor your treatment to the cause. But for general itching and symptom relief, especially if you haven't pinned down a cause yet, what are some of the home remedies or over-the-counter treatments that you broadly recommend that families could start with really doing little harm?
Yeah, some of the shampoos, like we talked about already, can be really effective. Some with selenium sulfide, the zinc, pyrithione, or ketoconazole. Those can all help with scalp itch due to a variety of conditions. Specifically talking about the scalp, parents could also try over-the-counter 1% hydrocortisone to help with itch, which can come as a cream, more of an ointment, which is more kind of like a Vaseline type consistency. Or you can find it in more of like a liquid form for the scalp. So sometimes people find using a liquid form is easier for the scalp. Other type of things, of course, you can try antihistamines. So cetirizine is a nice antihistamine to use in children and can be given once daily in the morning to help with itch throughout the day.
Are there any specific types of bathing or bath advice that you would give families when their kids are having itchy scalps or skin?
So definitely we recommend avoiding bubble baths, even though it's so much fun for kids. They love those bubble baths. We know that bubble baths actually dry out the skin more, and then there can be ingredients in the bubble bath that cause itching and dryness. You can actually do oatmeal baths. So there are some products out there, such as Aveeno, not endorsing, but Aveeno has some nice oatmeal bath packets that can be added to the bath water that can be quite soothing for the child.
That seems like one of those wives' tales or at-home remedies that actually has been shown to be helpful. Are there any that have been touted to be helpful but really don't work?
One topical or, cream that we hear about a lot of people using is Benadryl cream or diphenhydramine cream. That one we don't overall recommend. It just doesn't seem to be very helpful. So it's an antihistamine that's being applied as a cream to the skin. Again, if you're going to use an antihistamine, we recommend taking it orally, like with the cetirizine, as I suggested, rather than using it in a cream form.
So if those at-home remedies just aren't cutting it, what kind of itch relief can doctors provide through prescriptions?
Yeah. So some topical steroids can be very effective for itch. And those can come as creams, ointments, or liquids specifically. And sometimes for the scalp, we actually prescribe a steroid oil, which can be very nice, just kind of moisturizing and soothing when the scalp is itchy. So that's something that we prescribe often. There are a few specific shampoos that are prescription only that can be helpful as well, such as a 2% ketoconazole shampoo. There's also one called cyclopurox that we sometimes prescribe. And then there are prescription strength antihistamines as well. There's one called hydroxyzine, which we sometimes prescribe for bedtime when the itch is just unbearable overnight, and it helps the child get a little bit more rest overnight.
We all know it's so hard to resist scratching an itch. And if you're a kid, it's even harder because they're not good at self-control or knowing when to stop or knowing when they're actually maybe doing more harm. So do you have any behavioral tips to help parents get kids to stop itching or prevent them from scratching in the first place?
Yeah. So if they're a young enough child, you can actually try to cover their hands with like soft
Yeah.
mittens. If they'll keep those on overnight, that can be helpful as well. Or sometimes for the really little kids or even infants, some of their pajamas come with little coverings that can go over the hands. And so that can be helpful, just kind of that physical barrier of covering the hands. Trimming the nails short as well, that can keep the child from kind of digging into the skin and causing kind of deep scratches. And then behavioral wise, of course, distraction is one of the best tools for kids. We get through a lot of our painful procedures in clinic with distraction. It works
Yeah.
wonders. It's amazing.
Mhm.
So if you can try to redirect the child or distract them, if they're in an intense scratching episode, that can be helpful as well. But it can be quite challenging. And I know it's frustrating for parents.
Yeah. Well, thank you so much for joining today. It's been wonderful to have you sharing all your advice with us about itchy scalps.
Thanks for having me, Angie. It's been fun.
When it comes to treating your kid's itching, there are some things you can start with at home. Try specific shampoos to help with scalp itch and 1% hydrocortisone cream or ointment to help with body itches. You can also try an oral daily antihistamine. When it comes to baths, opt for oatmeal over bubble or extra soap. And if your kid needs prescription strength relief, doctors can prescribe topical steroids, specialized shampoos, and prescription strength antihistamines. And if your kid just can't stop scratching that itch, well, soft mittens and cutting their nails short can help. And when you run out of other ideas, distract, distract, distract. That's all for this episode. But if you have a question or a topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Mayo Clinic Kids episodes and resources, check out our website at mayoclinic.org/kids. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Okay, thanks for listening.
This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.